All right, how's everybody doing? Good afternoon. My name is Nisha Kalmati, and it is my pleasure to welcome Dr. Windsor today. So a little bit about her before we begin. She graduated from Midwestern University Medical School in Arizona, and she's trained in emergency medicine. She's been practicing since 2009, and she's an associate professor of medicine at the University of Arizona College of Medicine in Phoenix. And she's also a clinical assistant professor at Midwestern University in AZ. During the pandemic, she has supported her peers and physicians by becoming the ACEP National Wellness Spokesperson, a peer and litigation coach for Envision Physician Services, and a peer coach for the Arizona Medical Association. It is with her passion for positive psychology and her undergraduate degree in psychology that she was inspired to become the founding president of Life, a nonprofit organization. Please welcome Dr. Windsor.
Thank you, Nisha. I appreciate that. Okay, I'm going to attempt to share my screen here. All right. Can you hear me okay, everyone? Anyone?
Yes.
Okay, great. So before I begin, I am going to ask and remind people to download or print out the 3 exercises that we have so that you can do it as I talk. I'm a multitasker and have ADD myself, so it helps to kind of be able to do that while you're listening to a presentation, and I hope to keep you engaged that way. Okay, so my topic today is, are you at risk for burnout? Like Nisha said, I am the current president of the Arizona chapter of the College of Emergency Physicians, as well as I started the wellness committee. And then I started my own nonprofit organization that focuses on providing mental health support, as well as trying to eliminate and decrease burnout. Can they see me? Are you able to see me?
Can you share your screen with your slides?
Oh, can you hold on one second? Sorry. Thank you. Okay. Back to where I was. So the nonprofit organization that I founded was 10 years ago when I started to experience burnout in my personal life, not in my career. And so the whole premise behind it was that we would focus on providing mental health support, well-being, and speakers, as well as tools to try to decrease burnout and help people to find positive ways to cope with life. And throughout this presentation, you'll learn why. And this will be a very open, heartfelt presentation. I believe in sharing your story, because without your story, it does not impact others or motivate others to improve their lives. And I think I have a unique story, and I believe that we all have a story to share. And I always encourage you to mentor, to pay things forward, and to not be afraid to share your story. So that's where you will gain and benefit, hopefully, from this presentation. Okay. I would like to thank the Pre-Health Conference for inviting me, especially Alexia and Nisha, who have been so helpful. And I'm so impressed at such a young age you guys are doing these things. So thank you for that. Okay. My disclosures, I really don't have much to offer as a disclosure, except I do have a nonprofit organization that benefits sometimes from this work and awareness. Okay, so I really wanted to talk to you today about, are you at risk for burnout, and how to identify if you're at risk for burnout? And the reality is, I know you're a pre-health conference. However, especially during the pandemic, I think we've learned that anyone can get burned out, whether it's in life, personal relationships, career, education. and it's across all industries now. I've been an advocate for this for about 10 years, and nobody has listened until the pandemic. So that is one of the silver linings, is people are actually starting to open up to this awareness and to help to prevent it and to treat it. So these are the signs of burnout. And it's interesting because even myself in doing this work, it's been hard for me to recognize the signs of burnout. But basically in doing the research, I realized I have every single one of them. So you're going to feel tired and drained most of the time. And especially during the pandemic, I think a lot of people felt this way. I know I did. Lowered immunity, you get sick frequently, headaches, musculoskeletal pain, changes in appetite or sleep habits. Maybe you're sleeping more or sleeping less. Cynicism at work. I mean, especially in the emergency department, I got to tell you, we have a lot of cynicism because, number one, that's just our personality type, and we're dealing with high stress situations. But also, we kind of survive and cope through humor and cynicism. And keep in mind, not all of these things are negative. Your body is trying to cope and trying to get you through, and we'll go into that later. Feeling useless or incompetent. Maybe you feel like you're not effective, or you can't do it, or you can't get into medical school, or you can't, make it through the MCAT. I mean, I've had all of these feelings myself, and I'm happy to help anyone and coach you through that. Maybe you're, depressed. And of course, if you're exhausted, cynical, and feeling useless, no wonder that you're depressed. I mean, obviously depression has an open opportunity to set in there. And job dissatisfaction, or maybe where you're at in your education. Maybe you're doubting yourself, doubting your path. These are areas in which burnout presents, and it's treatable. So who is at risk for burnout? Now, I am a fan. Okay, so this is where we're going to go into the first activity, the adverse childhood experiences. And I offer an open-ended conversation here. So at any time, if you have a question, concern, or, in doing this work, my biggest disclosure in doing this work is you may be triggered. And if that's so, and you start to get anxious, depressed, or have some sort of traumatic experience come up for you, I have on our nonprofit website, we have a crisis team that can help you work through it. I have my email address on the first slide. Email me, I'll call you, whatever you need. But just know that whenever we're trying to increase awareness about our history, our behavior, our exposures, it can definitely surface some things for you. So please reach out if that happens. I would like you to go to this link, and you can do it right now as we talk and as I share my story on your cell phones. And it maybe takes 10, 20 seconds at most to answer these questions and to get your ACE score. So that's an adverse childhood experience score. So basically, there are about 10 questions I think they ask you, and it has to do with physical, sexual, verbal abuse, physical, emotional neglect, separation, divorce, a family member having mental illness, substance abuse, somebody being incarcerated, or maybe even as a child witnessing a parent being abused. And the thing to note here is, as children, all of these stressors significantly impact us as children. And it's mainly because our brain isn't quite developed, and therefore children are impacted 10 to 20 times more than adults when they go through these adverse experiences. So go ahead and click on that link or whatever QR code was provided to you so you can do your own score, and feel free to reach out to me if you have any questions or concerns or anything comes up for you in doing this. This is an amazing TED Talk that is about 10 minutes long, provided by Dr. Nadine Burke Harris. And it kind of describes the whole ACEs score and the studies behind it. So basically, the initial study was done it was 1995 to 1997. It was with the CDC in Kaiser Permanente in California. Dr. Vince Folletti and Bob Onua were the primary investigators, and they actually surveyed and followed for decades over 17,000 people. And so this is how they were able to come up with these conclusions and results in their study. So basically, they discovered that there was one exposure that dramatically increased the risk of developing 7 out of 10 of the leading causes of death in the US, okay? Those who were exposed in very high doses have 3 times the lifetime risk of developing heart disease or lung cancer. And for those children who were exposed to these adverse childhood experiences, it equates to a 20-year difference in their life expectancy. That's huge, huge. So she'll go into more of the details behind that. Oh, sorry, I went too fast. But I'm going to talk a little bit more about what childhood trauma is. So keep in mind that ACE score stands for adverse childhood experience, and how the exposure to adversity affects your developing brain and bodies as children. So basically, when you go through the test, which hopefully you're doing right now, for every yes that you say to one of those questions, you get a point on your ACE score. And they correlate ACE scores against many different health outcomes, whether it's physical, mental health, or whatever. And what they found throughout the decades of doing their research is that ACE scores, number one, are incredibly common in our regular community. 67% of the population has at least one ACE score, which is huge, right? Just one. And one ACE score puts you at significant risk for not only physical and mental health issues, but where I'm going with this today is this sets you up for burnout. So that's the whole premise and purpose of me bringing this up. Plus, I have a personal story to share about that. And then 12.6%, or 1 in 8 people, have a score of 4 or more. And that's huge and very significant towards your physical and mental well-being. So what they found is that in doing this and measuring the numbers, there is a dose-response relationship between ACE scores and your health outcomes. The greater your ACE score, the greater your health outcome. For example, depression. ACE scores 4 or more are 4 times greater risk to develop depression. Suicidality. If you have a 4 or more score, you have 12 times greater than the general population to develop suicide thoughts and be at risk for suicide, which is huge. And, part of the reason why I present this is to let people know that this is not your fault. Many of you are well educated in epigenetics and understand your predisposition to health and mental health issues, right? Or risk factors. And I just want you to know that the importance in doing this work is recognizing this is not your fault. These are traumas that you may have sustained as a child, but having the awareness branching into your adult years is going to help you to not only decrease your burnout, but to help you have a healthier physical and mental lifestyle moving forward, especially if you're going to go into a very high stressful industry such as healthcare. So this is why I'm bringing this up, okay? ACE scores of 7 or more put you at 3 times lifetime risk of lung cancer and 3.5 times the risk of ischemic heart disease, which is the #1 killer in the United States. That's huge, right? It makes sense though, when you think about this, and when they initially did the work on this and the research on it, and Dr. Harris will mention that in her TED Talk, which I highly encourage you to listen to the whole thing. So what they kind of surmised was, wait a second, this isn't science. It makes sense. If you have a rough childhood, then you're going to have, increased risk factors for engaging in high risk behaviors, right? And that makes sense. Yeah, sure. But that's actually not what the research found. So what they found is this is taking engaging in high risk behaviors out as an equation and as a part of the variables. So this is just more of a physiological effect of the childhood trauma and how it's induced into your body, which is insane. So I'll go into that a little bit further. But basically, exposure to an adverse childhood experience affects your developing brain. And that's why it's more important in children and young adolescents. I mean, the reality is, as most of you know now, especially in the male population, our brain isn't really completely developed until we're about 28. So a lot of us are, I wish I was still experiencing this, but I'm not. I'm outside of that age group. But many of you are still in that age group, and your prefrontal cortex is not completely developed. So trauma and stress is affecting you and somewhat setting a trigger to make you more reactive with future stresses. So keep that in mind as we have this conversation. So basically what happens when you're a child with a developing brain who is experiencing these adverse childhood experiences and traumas, what it's doing is it is affecting your nucleus accumbens, and that's the center of your brain that is controlled or controls our pleasure and reward center. And what that does is it kind of sets you up for substance abuse. And another area of your brain that is being affected is the prefrontal cortex, which, like I said, is not completely developed and mature until you're 28. And therefore, that affects your impulse control and executive functions. And, we need our executive functions for learning. And that may be why sometimes you can't stay focused or you have some ADD, ADHD type of symptoms, but it's mainly having to do with that prefrontal cortex. And then another area is what they found when they were looking, and I love the fact that neuropsychology has really advanced and they can measure all of these things scientifically. So they can measure in MRIs and other scans, but basically measurable differences that they found on MRI scans in the amygdala of the brain were huge with children and adolescents who had experienced trauma growing up. And then what that does is that sets your brain up and triggers the, sympathetic nervous system for fear. You're either going to fight or flight, right? That's your whole nervous system for the sympathetic nervous system. That used to actually be a very evolutionary, positive, adaptive process for us. That is your brain trying to save you and keep you safe. However, in children who have experienced significant trauma, they have bigger amygdalas. Therefore, they're more geared up to go to stress and sympathetic nervous system response, which means increased adrenaline, cortisol, and then you get all the physiological side effects of that. And that's not your fault. That's not, and I have a bigger amygdala. That is my story, which I'll go into, but it's not our fault. We grew up that way, and therefore our brain developed that way, and it's hardwired that way. So how you undo that, you have to work through these you have to create new neuro pathways, and it's actually very easy to do. And thank God for the research in that. And there are simple apps. I can share all that with you. Anyway, even if you don't engage in any high-risk behavior, you're still more likely to develop cancer and heart disease if you have a high ACE score. So then someone might say, okay, well, why is that? And that goes back to this heightened, triggered fight or flight sympathetic nervous system. So basically what happens if you see a threat, right? A bear in the woods, it's your hypothalamic pituitary axis. And that is your brain and your body stress response. And these are the systems that govern your fight or flight response. So what happens is you see the threat, and, based on evolution, historically, we needed this to survive because, many humans didn't survive after 40 years of life because there were just so many things out there as threats. So you see a threat, and then what happens? That triggers your hypothalamus. And then what does that do? Triggers your pituitary, which triggers your adrenal glands. And then it releases stress hormones. So you get the adrenaline, cortisol. And what does that do? That increases your heart rate, which puts you at increased risk for heart disease over time. And then your pupils dilate, your airways open. Why is your body doing this? Well, this used to be a very adaptive process to get you to fight or flee so that you could be out of the risk, right? So what happens when this system is activated over and over and over again, especially at a young age? What happens? Not only does it predispose and hardwire your brain to go to a reactive place and to go into sympathetic nervous system mode very easily, it also affects every single organ in your body, hence putting you at increased risk for heart disease, lung cancer, and other illnesses, quite frankly, especially autoimmune illnesses. So children are especially sensitive to this, especially if it's repeated over and over. So think of a child living in an abusive home, and that bear that was their threat is in their home, and they have to see that bear every day and be exposed to it every single day. That is setting them up for a lifetime of this system being activated over and over and can be triggered so easily. That's why I also say, if any of this is triggering you, please reach out to me or my crisis team at Life, which the resources have been provided to you. High doses of this affect brain function, immune system, hormonal systems, and even the way our DNA is read and transcribed, which is insane, right? So if you are in a stressful relationship, stressful home life, stress at work, at school, this is actually changing your DNA. So what do I offer? Well, we have to find ways to offset this or calm the system. Otherwise, it is going to put you at increased risk for burnout, whether it's in your relationships, in your life, in your work, in your studies. And I think that's, one of the things that we found with the pandemic too. A lot of people were getting triggered, and it was just causing all industries and all sorts of people to feel overwhelmed and burned out. Why is this relevant? Well, if you have a higher ACE score, you're already set up and predisposed to be burnout. If you have a high ACE score, it does not mean that the world is over. There are ways to combat that, treat it, and to offset it, and they can help you with that. You may need to do more work. If you have higher ACE scores, you're going to have to do more work. Your career and education may need to be more meaningful to you and less stressful, and these are things to consider when you're going into healthcare. However, I will say that if you have higher ACE scores, you probably have more compassion and acceptance of the patients and the people you care for, because you understand that they're maybe coming from hard places, and you can understand why their behavior may be such. But I also think it's important to recognize you need compassion for yourself and more acceptance of yourself, because this isn't your fault. This is where you're at. And there are ways in life to work through this professionally and personally. And use this to understand the physiological science and psychology of why things may be more challenging or difficult for you. This, sometimes you have to work a little bit harder because of this. Give yourself a break. Give yourself permission to understand the ways in which you may be coping with life. It's not your fault. It may be because of this. Okay, so I'm going to tell you my story while you're figuring out your ACE scores and still doing that and kind of contemplating what I brought up for you. So it embarrasses me to say that my ACE score is, based on perception, and I'm sure you've seen that when you look through the questions, I'm an 8 or a 9. Like I should be dead or on drugs on the street, you know. I did not, unfortunately, have the best supportive family growing up. There was a lot of stress on all different levels. And to be honest, the only thing that saved me was education. And it was through education that I was able to learn and break out of my family situation. And I was the first one in my family to go to college. And that, quite honestly, saved my life. I went to ASU. I had an undergraduate degree in psychology. I really thought, my brother, when he was 17 and I was in 5th grade, committed suicide. So I really thought that was how I could give back to the world, is get a degree in psychology and go back and help all those children who, were suffering from depression and anxiety. But then it led me down a different path, and I ended up going to medical school only because I had an incredible mentor who told me I could do it. I didn't have parents growing up who said I could do that. So I went to Midwestern University, and it was the perfect place for me. And I ended up doing my emergency medicine training in Kingman. These are my kids, by the way. I wanted to give you a little personal side of who I am and what I deal with. And now, unfortunately, when you grow up as an adult and you have your own children, you have to deal with their stressors too. So I'm trying to make sure their ACE scores are not high and break that cycle. Outside of Kingman, I started my first job 2009 at Honor Health JCL in the emergency department. And, I started to realize that some of our physicians needed this work, and a lot of them were predisposed to have this high potential for burnout. So we are Envision owned, which is a big national corporation that owns our group. So I became the education director, and I thought through education, I could help mentor students and try to, increase an awareness about this and help them get longevity out of their career and their education. And then I became the EM site director. And then I was doing some work on physician engagement because none of our physicians were showing up to our educational CME conferences that I was putting together. And I realized it was more of a wellness issue. Everybody was kind of overcommitted and stressed and on the brink of burnout. So then I turned it into more of like a wellness approach to try to support our physicians. And then emergency physicians, Arizona chapter president, but then like their national wellness person. So where am I leading with all of these things? I'm leading to my coping mechanism, which has been overachievement. And I don't know if there are any of you out there dealing with overachievement, but that is a coping strategy. It is a productive and healthy strategy until it's not, until it burns you out. So I put this in here because I did get burned out in doing all of this. However, if you compare it to things, it's better than being on drugs and being on the street. So I will take that, but this will increase your probability of burnout. So you have to be very careful with that. That was my major coping mechanism growing up and how I learned to deal with that. So we have our first poll of questions. And Nisha, I'm going to leave that to you. I don't know if we're going to be able to see the poll. If I can see the responses, that would be nice because then I can interject. And then also, please keep me apprised of the time. How much more time do we have left? Well, so far on the poll, I love the engagement of it. And I, agree. I've been doing this wellness work for a long time. And I mean, maybe it was 8 years ago when I came across this research, but I had no prior knowledge. And this has been out for decades. And right now on the polls, we have 91% saying that, nope, they had no prior knowledge of the ACE studies. And I did in my references at the end of the presentation, I added all those references so you can actually read the studies and look into it. And I'm interested in doing a study comparing the ACE scores with burnout in healthcare workers. If anyone needs a project and wants to do that, let me know. And then have you taken the ACE assessment? So we have 90%, great engagement. Good job, people. And then were you surprised? Right now, many people may still be processing, but yeah, we have 10% saying that they are surprised by their score. Okay, so I'm going to end it just in the interest of time. Yeah, okay. So we can share results, and then there it is. I'm new to this, so I'm going to say stop sharing. We're going to move on. Okay. Oh, here we go. Okay. Oops, it's not letting me move on there. Let's try this. Okay. So now this leads me to the priority circle. So I came up with this mainly because it's more simplistic, and I've done a lot of physician wellness work with our emergency medicine physicians, and many of us have ADD and we need something simple and quick, like 30 seconds to the point. If it's greater than 60 seconds, I'm no longer paying attention. So that's also why I made this interactive, so that hopefully I would get more engagement from you all. But basically, I want you to take this handout, and hopefully you printed it or were able to download it. And I want you to put your 3 highest priorities down right now. Number 1 goes in the inner circle, and number 2 goes in the second circle, and then number 3. And we're going to take some time to do that right now. And you know what? I might advance to the polling questions on this. Okay.
Hey, Dr. Windsor, we're going to send an active document after the presentation.
Oh, I'm sorry, what?
We're going to send this document after the presentation.
Okay.
Yeah.
Okay. All right. So then we'll move on. So
thanks so much.
No problem. Basically, the priority circle is just to kind of get an idea of where your priorities lie right now. Are they where you want them to be, or do they need to be adjusted? And I've done this work with physicians and nurses. And the interesting thing is, ultimately, you should put yourself or your faith in number 1. And most of us don't. And every time I've done it, even knowing the work, I still always forget. So I put like my my family or work or my children or my husband or whatever. And many of us forget to put ourselves first, which is key. So that's a big awareness that I want you to come up with in doing that practice. And then if you want to get more in depth, you can do it. The circle of intimacy, it was discovered, and this is credit to my good friend, Kathleen Thorin. And she's the one who gave me privileges to use this. Her contact information is there. If you want to go more in depth with relationships, family, work, whatever it is, church, she can help you with that process. And she's open. If you go through life, she can do this work for free, pro bono for you. Okay. You just have to mention life, and that's how you heard. But I'm going to skip over that. But obviously I gave you that information. So you can follow up with it when you get the presentation later if you want. And then this leads me to the life wheel. So the idea of this practice is to generate and create awareness for where you are today in your life. And also when we talk about burnout, recognize that burnout is transient. You may be burned out one day today in your relationship. Tomorrow you're fine. One day you're burned out in, education or work, but that changes day to day. So thank goodness that is not like solidified throughout your life. Okay. So the Wheel of Life, or the Life Wheel, was originally developed in the 1960s by Paul Meyer. It's a coaching tool. And so the cool thing about this is right now you have 8 areas of your life, and you can see on this diagram 1 through 10. So 1 being I'm terrible in this area, 10 being I'm awesome in this area. So what you're supposed to do is kind of color in those areas up to whatever measurement you think you are. And you need to be honest and truthful, because if you say you're 6 and 7 on all of them, likely that's not true, and you're not doing a genuine service to yourself. So be honest with it. Like finances, maybe a 1 or a 2, and see where you lie. And the nice thing about this is you can do it anytime and just kind of check where you're at. The first time I did this in a retreat for our emergency medicine physicians, I did it myself. And I realized I was doing pretty well in some of the areas, but I had like 0 fun and relaxation in my life. And so the bottom little example and diagram shows you the areas in which you need help. There is a YouTube video here that I reference for you so you can get more information. These are the categories that they go over. However, you can pick and choose your categories. And like, for example, fun and recreation may be different ones for you. Family and friends, well, guess what? If you don't have a great family life or background, but you have amazing friends, you may want to separate that out because you may be dealing with different issues there. Health, maybe your diet's not good. Maybe you're not exercising. So maybe you need some help in that area. Finances, well, that was always an issue for me as a student. So, obviously you may be in a position of not being able to completely change that area. But ultimately, and this one you'll notice has different ones. They put in different aspects. So this is what I like about this practice is you can change all these areas to be what suits you personally. But then you see what happens here. And when we do this practice in person with physicians, we actually make them cut it out. So you map your points, like connect the dots, right? And ideally, we are supposed to have a circle, a wheel of life that actually rolls forward. But if you look at this, if you cut that out, do you think that wheel is rolling forward? I still have yet to have a wheel rolling forward. I'm always working in various different areas of my life. So I wanted to give you the website to life. There is a great YouTube talk that I've given previously, and another presentation I've done on burnout that may help you. But again, I have provided my email address and contact information, so please feel free to reach out to me. And if we're always looking for volunteers, if you love this work and want to help students do this work, please reach out. Are we going to do the life wheel poll, or maybe save that for later? These are the questions that I have included in the last poll. So I would love this feedback. Was this presentation, did it offer new information to you? Do you have a high ACE score? Can life support you in this area? Are you looking for a mentor? I love mentorship. I'm always willing to mentor students. Would you like to become part of the life team? And if you enjoy the way I present a topic, I'm happy to come back and do that again. And then these are my resources. Did the presentation. Okay, we have a new poll coming up, but I'm waiting for responses. And then we're going to open it to questions. So hopefully we should have approximately 20 minutes open for questions. Yeah, so far in our poll response, did this presentation offer new information about yourself? We have 88% saying yes, and then 14% saying little, 3% saying no, not really. Do you have high ACE scores? We have 35% saying yes, and 66% saying no, so that's great. And then, can life support you in this area? Life meaning my nonprofit organization. We have 100% saying yes. That's great. Well, I'm happy to help. One of my goals has always been to have a chapter on each college campus for pre-med students, because what you're doing right now is probably one of the most stressful times of your life. Your career, your future is uncertain, and it's really hard to sit with that, and it's really hard to know that other people are predicting your future and your career, and you're not necessarily in control of that. Hi, Nadine. I'm sorry, Nisha. Are we going to open up to questions?
We're good to end the poll, and then we'll open up to questions.
Okay, let me see.
And I'm getting a few private messages for questions in the chat. If you have any questions, feel free to share them in the question and answer section. If you don't want your name associated with the question, or you feel nervous about it, there's an option to send the question anonymously. So please remember that.
So I clicked on the Q&A and I have some questions. Should I just start going over those?
Yeah, I'll read them out to you and you can answer them.
Sure.
So our first question is, can you talk about it's like in medical school, specifically how feasible it is to start a family when in med school, or how MD PhD program in light of burnout, stress, or heavy workload?
Well, I will say for me, I was not the best student. It took me about 3 times as much effort to learn the material in medical school. And I personally would not have been able to handle that stress of having a family and raising kids. However, I had classmates. I had a female classmate who had 5 children, and she had her 5th, I think it was sophomore year, and she would bring her child to class and breastfeed in the back of the room. And, she had a husband, obviously, who was a stay-at-home husband, so she had support that way. I think it does go back to, how are you as a student? Do things come easily for you? Because I don't think that it's a time to add the added stressors of being a mom and having children to raise, unless education and testing is easy for you. For me, it was not, and it would have been very challenging. That's why I waited till residency to have children.
Okay. Second question that we have is with regards to the previous statistics shown. This attendee is asking, these are just statistics, so it doesn't necessarily predetermine anything, right?
True, but it's statistics based off of almost 3 decades of research now. So what they've done is they've followed all of these subjects, and they're still following them today. And, they followed them to their death. And there is, in one of the references, specifically how the ACE score, how your ACE score relates to burnout. And everybody's different. I mean, for example, look at me. I mean, based on my ACE score, I should probably be dead or on drugs, right? But I'm not. And that's my whole point of presenting it to you. There were other ways to break through those barriers. And just like genetics, just because we are genetically predisposed to have an adverse health outcome, it doesn't mean that we can't change our environment and our behavior to offset that. And that's the whole purpose of this.
So someone asked, how can you compensate or change this if you did experience trauma as a child?
There were a lot of things. You have to do some self-work to process this trauma, because what I found in doing the physician wellness is a lot of our, physicians who are reactive and, get stressed when there's a critical patient or yell at the nurses or whatever, it's because perhaps they had these issues and never learned maybe how to emotionally regulate that, or how to offset the stress and cope with what they may be feeling internally. Therefore, you do have to do your personal work. And there's There's a great organization that we're working with that does, especially during the pandemic, that does trauma work, PTSD work, and it can go back to your childhood and process all these things to help your brain and body release them, but also can work with you currently. And we use it sometimes with some of our staff for debriefing on a horrible case or a situation that they were involved. And I'm actually doing research on that to prove that it's effective. So there are ways, and if you are interested, you can reach out to me personally and I'll put you in contact with someone who can help you.
Okay. Someone asked, can you talk about the taboo of mental health and medical careers and how mental health issues can hurt admission into medical school?
Okay, a lot has changed since I was applying to medical school. I mean, I now hear from you pre-med students that you have to take a personality assessment as one of the levels of certain entrances and application processes for medical school. So that's new. We didn't have that. I don't know where I sit with that. I'm not sure that I think it's a great idea. You know, in terms of admissions, I'm not sure I really think that's fair, but at the same time, you know, hiring people, and when I used to review the resident applications in my program, it's helpful if you're on the other side of things, but I'm not sure that helps you as a student. What I will tell you that I've done in my personal work through wellness and mental health is I've worked at a state, and I've actually worked at my hospital system as the state of Arizona and nationally to change the board requirements for physicians and residents and medical students who may have anxiety, depression, or some sort of mental health diagnoses, that doesn't limit you from being accepted, getting privileged at a hospital, or getting your license approved at a state level. And we were able to change the wording, and there's still movement across the United States to continue to change that. But it does depend on your state level, your school level, your hospital privileging level. It's different, but there's huge movement. I'm, a wellness champion for Envision Physician Services, and that is one of our current initiatives where we're trying to change that across the board to make sure that that stigma is no longer in existence. But it's going to take time, and I'm working really hard to do that.
All right, thank you. Somebody asked if you wouldn't mind explaining the ACE score again. This speaker is concerned that they got a very low score, or maybe not concerned.
That's great if you have a low score. Congrats to you. I'm very happy for you and your parents who gave you a very good childhood. Here's the thing. You can do it again. You can do some research on it, look back. Some of the questions, it could be a matter of perception. That's why I told you I have an 8 or a 9, depending on how you really define some of the questions in there. But the thing to remember with the ACE score is just a score of 1 still puts you at risk for all these adverse health outcomes and mental health issues. So if you have a 0, good for you. And you know what? Good for your parents. You better thank them and appreciate them today, because they did well. They did well. But 67% of the general population for the last 30 years that they've been monitoring this has had 1 or higher.
This is a very popular question here. Who do we contact to get involved?
With Life?
Yes.
Okay. So I did include on the first slide, and then I think one that was maybe 4 or 5 back, I did include our website. So you can go to that link, and then there's an area where you can sign up and put in your contact information and give me a message like, hey, I want to be a volunteer. We have student ambassadors. We have volunteers at all levels. We're actually restructuring our officers and volunteers right now, because we're going to be pushing into September, which is Suicide Awareness Month. And we have our big pickleball tournament, which is our fundraiser. So you'll be seeing a lot of information out on Life for that. We're also on Facebook at Life Nonprofit Organization, and Instagram at living.enlightenment, and Twitter at Life Nonprofit AZ. And then even on our website, we have a QR code, so it will populate all of those various social media sites.
All right. Are you looking for any interns or research assistants for the work you're doing or looking to do? And what could we do as part of the Life team if we were to join?
Absolutely. Always. We're looking. So what we're really gearing up for right now is writing up grants and applying for grants to try to increase the work that we're doing and to take it locally to not only university chapters, but for the pickleball tournament and fundraising for suicide awareness and prevention. We're actually going to use those funds to start a program at Xavier College Preparatory, and I'm supposed to be a speaker there for their inaugural wellness retreat that they have. And what we're trying to do is actually provide, I'm a firm believer in giving you tools. That's why I made it interactive and gave you things that you can do. Because as you'll see, even in medical school, they have to provide wellness information, but it's just information that doesn't really help you. You're like information overloaded, right? You need tools, you need resources to go to. So that's what I'm trying to raise money for, to start that at Xavier. And I wanted to start at ASU and all the local chapters, but it takes people and time and support. So whatever you're willing to do, we have a lot of positions open right now because we're restructuring.
Okay. Somebody asked, what steps would you recommend to avoid burnout if your specialty or career is highly stigmatized or demeaned by the public/politicians?
I think, first of all, I'd have to talk to you individually to see what area, of politics or whatever you may be dealing with. Because there are certain careers in certain areas where it is like emergency medicine. I mean, that's probably one of the most stressful careers you can choose to go into. And I do have some ways to help you, but the underlying guidance I could give is to let you know that whatever you do, especially right now when there's a high level of burnout in the healthcare community, is to recognize that it's all about your passion and your drive. And if you're doing this because your parents want you to, or you feel obligated culturally, or because of your parents, then you're not going to get longevity out of your career. You need to have the internal passion and drive to do this work. And it doesn't matter what it is, whether you're a CPA, whether you're a teacher. I mean, think of the teachers during the pandemic. I mean, I pray for them and we supported them as much as we could, because that job has a high burnout rate and continues to, and they don't make an income that even offsets any of that. So it really comes down to internally, what is your passion? What matters most to you? And that's your drive. And that will help to decrease your burnout.
I think we're going to have this be our last question then. Someone asked, this person's working in the emergency department in California. How can this person get involved with your work on burnout?
Oh, well, just email me. Shoot me an email, go to the site, shoot me an email and tell me your name, your interests, and I'll get back to you personally and I'll call you. Give me I prefer to connect via telephone. I am zoomed out from all, to be honest. So usually when I'm on a meeting, I don't have my video. I have a photo up there because I got zoomed out, but I would prefer to connect with you via telephone, and I would have some time next week to do that.
All right, perfect. Well, thank you everybody for coming out for this presentation. Thank you so much, Dr. Windsor, for giving us the time to create this presentation, for including all these interactive elements, and again, for everything you've done.
Thank you.
Sorry, go ahead.
No, I said thank you. And thanks for inviting me. And I would love to come back if you guys have a topic you want me to present on.
So the interactive elements that we've had in this presentation, we'll be sending out that PDF in an email to you guys. And our next session is going to be a medical student panel. So please go ahead and transfer to the next room. We'll see you guys there.
Take care.